Strive Masiyewa has spent almost a year working hard with Africa's CDC to ensure Africa has access to COVID-19 personal protective equipment. And now, the AU Envoy on vaccine acquisition is hard at work to ensure that the continent has access to the vaccines and Africans are vaccinated.
400 million doses between now and September. We contracted UNICEF to do the distribution. So the vaccines are produced at the Aspen facility in Port Elizabeth and shipped to UNICEF warehouses, where they are then repackaged to meet the order schedule on a month-by-month basis.
The Africa Center for Disease Control has acknowledged his hard work.
I've never met Mr. Masiyewa other than on the platform that we work every night to secure these vaccines. But I must say that it has been a learning exercise, and he's truly the hero. I mean, I call him in our informal discussions as our COVID vaccine warrior for the continent, because he knows exactly where every vaccine is hiding, and he has had talks with them. He calls me in the middle of the day and said, "John, I just called this company and they're having this vaccine. Let's get on the call and find out what is going on there." He knows every vaccine that is going on across the continent. And perhaps when the history of this will be written, and I'm sure it will be written, I think the history of Africa was written during the 1960s, and those who were heroes were then Kwame Nkrumahs, then Jomo Kenyatta's, and the Haile Selassie's. The modern days Pan-Africanists will be, in my view, people like Mr. Masiyewa, who actually rose up to the task. This is not the first time he's doing this. When we were in acute needs of diagnostics, he was the first person who created the African Medicine Supply Platform, which completely unblocked our situation with respect to testing.
Both the Africa CDC and the AU Envoy have emphasized the importance of vaccines.
Vaccines save life. I think that there's no doubt about that. And even if we have one or two reported side effects, that it doesn't negate the fact that the benefit largely outweighs any secondary effects that we will have. I'm here this morning because, and perhaps the only reason I'm here with you this morning is because I had my vaccines in April, the full immunization in April. But then last weekend, I came down with COVID. And as you can hear from my voice, I'm still struggling with COVID, but I think the worst is over. And if I hadn't had those vaccines, and if I was gambling with whether I would have side effects there or not, I can assure you that it would have been over for me by now.
When we planned for this press conference yesterday, we had to have a contingency. Will John be available for this press conference? And really, I just want colleagues to acknowledge the dedication of this man. But vaccines work. There's a beautiful graph which John showed the ministers of health and finance.